Hello and welcome back to Medical Channel Asia. My name is Linges, and today we'd like to shed some light and discuss a rather controversial topic known as hysterectomy and the importance of protecting women against unnecessary hysterectomies. A hysterectomy is a surgical procedure where doctors remove part of or the entire uterus due to underlying cancerous roots. However, this procedure is becoming increasingly common in recent years. Did you know that in the United States alone, over 600,000 hysterectomies are being prescribed every year? By certain counts, a third of American women will have experienced a hysterectomy by the age of 60. And these numbers are actually rising in Asia as well. So these are alarming statistics that we should all be concerned about, considering that these hysterectomies are being performed on conditions that do not require a hysterectomy at all. Now let's dive right in together. Generally, there are three types of hysterectomies: a radical hysterectomy, a total hysterectomy, and a partial hysterectomy. A radical hysterectomy is not only the removal of the uterus, it also includes the removal of the cervix, the fallopian tube, the ovaries, and other attachments of the reproductive system. A total hysterectomy involves the removal of the uterus and the cervix alone, while a partial hysterectomy only removes part of the uterus. Now, hysterectomies are definitely necessary for conditions that have underlying cancerous roots. However, they are being prescribed as first-line treatment for benign conditions such as PCOS, endometriosis, and adenomyosis. The issue being that this condition is being overly performed and overly prescribed to benign conditions that do not require hysterectomy. It seems that in recent years, if a woman brings a problem to her doctor involving the pelvis or the uterus, her doctor will immediately recommend a hysterectomy as a first-line treatment. While a hysterectomy may seem like a very quick solution, which it is, it may have a lot of unforeseen, potentially lifelong complications that the patient is not aware of. For example, a removal of the uterus can lead to a common side effect known as organ prolapse or pelvic prolapse, which means the organs, including your stomach, your liver, start sagging downwards. Another common side effect is urinary incontinence. Because of the removal of the uterus, the bladder is now unable to empty itself completely. There are other side effects, for example, early onset of menopause, early onset of ovarian insufficiency, infertility, and even constipations. These side effects are not talked about enough and can lead to a dramatic decrease in quality of life. Furthermore, women also report experiencing a decrease in sexual satisfaction or intensity of orgasm post-hysterectomy. Over time, these complications can accumulate and cause a sense of depression and regret amongst women, and it can also lead to potentially societal problems that are unforeseen. For example, marital instability and divorces amongst partners. This is no fault of any woman. We understand that these women tend to experience extreme pain and frustrations due to underlying reproductive diseases that leads them to consider a hysterectomy in the first place. However, we still strongly believe that a hysterectomy should only be recommended under two conditions. Firstly, if the underlying root cause is malignant or cancerous. Secondly, if the underlying disease is life-threatening to the patient. Otherwise, there are therapies available today that can effectively treat benign reproductive diseases without the need of hysterectomies. Now, these include examples such as minimally invasive hysteroscopic surgeries or minimally invasive laparoscopic surgeries. However, these therapies, although they are available, it may be out of reach due to the comfortability, the training, and the exposure of the individual doctors. Many times, these doctors are not trained or not comfortable to do these types of technical surgeries. In conclusion, raising awareness to this issue is the first step in the battle against unnecessary hysterectomies. Now, we understand clearly that hysterectomies may be necessary and may make sense in the short term. Please always get your second opinion from your doctors before going for a critical procedure such as this. Remember, this procedure may cause lifelong complications and can affect your quality of life. Thank you for watching, and we're curious as to what your thoughts are about hysterectomies. Do you know somebody who's already gone for this procedure? How are they doing now? Will you consider this procedure yourself? Please leave your thoughts down below and let's have a healthy discussion. And see you in the next one.